Hi, here is a sample OET speaking with detailed feedback. This is one thing that many of you have been asking for, a feedback after a sample speaking. In this video, there will be two parts. In the first part, where you will see a sample OET speaking, where a nurse speaks to a patient, and in the second half, I will give you a detailed feedback based on the assessment criteria for OET speaking. So first, let's watch the sample speaking. This is a recording for the occupational English test, and the test is held at Medcity International Academy, Kannur on Tuesday, 4th of July. The candidate's name is Yashwant Batina and the candidate number is 8643. The interlocutor is Sangeeta Gopi and the interlocutor number is 25. This is roleplay number 1 for the profession of nursing. Good morning, Yashwant.
Good morning.
May I see your identification card, please?
Sure.
Okay. Right, thank you. Yashwant, this is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally.
Sure.
We will first move on to a warm-up session to get you started, and this is not in any way assessed. First question. Why did you choose to become a nurse?
Not like many others for money. My parents thought from beginning nursing is a respectable profession. So they want their one of the child to do nursing. So I ended up in doing nursing and I'm happy with my profession.
Okay, and can you describe a typical day at work?
Like many other nurses, my work starts at 8 a.m. I go and I check my patients' records. Anything needs to be met like medication or IV fluids to be done or any investigations to be done. And by the evening 5, I complete my shift and I come to my home.
Alright, and what do you think you'll be doing 5 years from now?
From now, I will be working in a prestigious hospital, doing my roles correctly and expecting a higher position in that hospital.
Okay. Alright, so Yashwant, let's move on to the role play now.
Sure.
I'll be taking the part of the patient and you will take the professional role. The role play will last a total of 5 minutes. You will be given 3 minutes to prepare for the same.
Okay.
The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No, ma'am. I'm good.
Alright, so here is a pencil and this is your card. Alright. You will have 3 minutes to prepare. You can make notes on the role play card if you wish to do so. You can look at the card during the test, but at the end of the test, you must return the card to me.
Okay.
Alright. So your preparation time of 3 minutes starts now.
How may I address you during the role play?
You can call me William. Alright, so Yashwant, that's the end of your preparation time. You will now have 5 minutes for the role play. Don't worry if I stop you, that would just mean it's the end of your time. Are you ready?
Sure.
Okay, so you can begin now.
Hi, good morning.
Good morning.
My name is Yashwant. I am one of the registered nurse working in this hospital and I am going to be your caretaker for today.
Okay.
Mr. William, how you feeling now?
I'm glad that you asked and it's so good to see you. I mean, just the last few hours have been tough. I feel a bit sore, kind of a dull pain that, I can still
As I can see in your file, you recently went for undergone a surgery for laparoscopic colectomy.
Yeah, that's
So
right.
because of that, you might feeling this discomfort. After the surgery, you will have little pain. That is quite normal.
Okay.
And I would like to ask you to rate a pain score, which is from 0 to 10. 0 is the least and 10 is the worst. So could you rate the pain?
Yeah, I think my pain would be somewhere between 8 and 9. No, let me say. I think it's a 7.
And I'm really sorry to hear that you're facing such pain. As you can see, we are giving some painkillers to make you to get comfort.
Yes, I've been given, I think, the painkillers, but do you think there's any other way to get rid of this pain really quick?
Yeah, sure. We are giving hot compress, and I try to change the position so that you will feel less pain in it. And I will inform the doctor anything additional needed to be done.
Okay, so you mean to say that I should keep shifting how I'm lying down on bed right now?
Not frequently. If you're feeling pain at some position, I'm going to place you in other position so that you will feel less pain, and subsequently your pain will get subsided.
Is it something that I should be doing, or do you think
No,
I'll have
I'm
an
going to
assist?
help you with it.
Oh, okay, that's fine. Okay, so when do you think you'll come in next to get me shifted?
For every 2 hours, I'm going to change your position. If you're feeling comfortable in the same position, I'm going to let you down. But I'm going to change it very frequently. Otherwise, you might get a bed sore.
Okay.
Are you clear, William?
Yeah, that's such a relief to hear that you'll be visiting every 2 hours, and that some kind of change will happen. But see, I just wanted to ask you one more thing.
Medcity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
About the tube that I have, the nasal one,
Uh,
and the one that I have on my hands. It's very.
I can understand that you feel really uncomfortable by
Yeah,
having
yeah,
all those
really,
things.
yes.
But those things are mandatory for you to have. The first one on the hand you have, it is called IV cannula, which
Okay.
helps you to give supplements like fluids, because right now you cannot take anything as you underwent colectomy.
Oh, so I cannot have any food.
No, you cannot have anything orally. So that's why we are providing you fluids. So as you recover from it, your IV cannula will be removed in followingly. And like
And how soon can that happen? I mean, it's just been a few hours after the surgery. I mean, will this happen today that I can get rid of all these?
I can really understand that you want to get as soon as possible, but it will take few days time, and I'm not the correct person to say when to this be removed. And the second thing is you have a nasal cannula that is very helpful to you right now, because right now you came from the surgery. So to maintain your saturation, like your breathing, right, your oxygen. So to maintain that, this nasal cannula is very mandatory to you now. I would request you to bear. It might be little discomfort.
So you think if I can talk to the doctor, I can get this removed soon?
Even if you talk to the doctor, as per my knowledge, I have seen many patients with the same condition. It will take you approximately 24 hours to get all this to be removed.
Oh, that's a long time.
And I'm sorry for that. And to get back to your normal life, it may take you 5 to 7 days.
Oh, okay. So should I be in hospital for those many days?
Yeah, you have to be in hospital for 5 to 7 days. And we will be providing diet for you, like providing sips of water, so that you'll gain back your strength. Is there anything would you like to ask?
I think pretty much everything you've just covered.
Okay, Nas. If you have any problem, any discomfort, there will be a calling bell next to you. You can just buzz that. I will attend to you and make sure you won't feel anything less while you're in the hospital.
Okay, that's such a relief. Thank you so much.
Thank you.
Well, that was an excellent sample speaking, I would say. Now let's analyze how the candidate has performed. In OET speaking, there are two broad categories based on which you are assessed. The first one is called as the linguistic criteria, and the second is the clinical communication criteria. So here I have detailed notes on each of these aspects, The linguistic criteria is scored from 0 to 6 and there are 4 factors in it, and the clinical communication criteria is scored from 0 to 3 and there are 5 assessment factors in it. First, let's analyze linguistic criteria. As the name suggests, it means how well the candidate has used English. So it's the candidate's English proficiency that's being tested. The first criterion under this is intelligibility. Intelligibility simply means how well the candidate can be understood. Here throughout, the candidate is audible, clear, and generally easily understood. I would say the word stress and pronunciation is good. Voice modulation is one area where the candidate will have to work a little more on, and also on the pitching of his voice. From start to end, he sounded just the same. There aren't long pauses, of course, and one area where the candidate can improve is on the influence of L1, which is his mother tongue, on certain words. For example, position, oxygen. So, in intelligibility, I would give the candidate a 4 out of 6. Moving on to the second factor, which is fluency, and that simply is the rate of speech. The rate of speech throughout is quite even, not too fast, not too slow. Very rarely has the candidate used fillers, which means he is confident in the use of English. And that itself has made the strain on the listener very minimal. If you've noticed, there is good flow of ideas, vocabulary control is good, and very rare hesitation. And that makes it so much easy to follow the conversation. Out of 6, under fluency, I will give the candidate a score of 5. Moving on to the third factor, which is appropriateness of language. And this implies the right use of words, expressions, and overall tone of the language used. Here the register used by the candidate is appropriate. The candidate needs to work a bit more on empathy. He did try and use the right phrases. For instance, when the patient gave his pain score, the candidate said, "I'm really sorry to hear that you're facing such pain." But the way he said it could have a little more of empathy in it. The use of technical terms is less, and the candidate is able to explain even complex aspects using very simple language. The technical context overall is managed well. For instance, when the patient spoke about something that he has on his hand, he said, "The first one that you have on your hand is called IV cannula." In appropriateness of language, I will give the candidate a score of 5 out of 6. Next is resources of grammar and expression. And in this, you can notice that the candidate has used a good range of vocabulary. For instance, supplements cannot have anything orally, pain will subside, and so on. There are good grammatical construction of spoken sentences. Overall, the candidate is able to manage clarity. I want you to bear in mind or gain back your strength. These are good usages. However, the candidate did have a few seconds remaining towards the end of the role play, which means towards the end of his 5 minutes, he did have a few more seconds remaining, but that can be overlooked. And under resources of grammar and expression, I would give him a score of 5 out of 6. Moving on to the next broad category, which is clinical communication criteria. And this simply means how well you can manage a conversation in the clinical context. The first aspect here is relationship building. And if you've noticed, the candidate did maintain a good rapport with the patient throughout. The way he opened the conversation was well, where he introduced himself clearly and starts by using the patient's name. For instance, he said, "Mr. William, how are you feeling now?" And that establishes the relation he already shares. It simply means he knows the patient. Throughout, the candidate maintains a warm, respectful attitude. He's good at engaging the patient and ensures to calmly answer all the queries that the patient has. So, in relationship building, I would definitely give him a 2 out of 3. The second factor is understanding and incorporating the patient's perspective. Now, this is one area where most students fail to live up to the expectation. But here too, the candidate has performed quite well. It means the candidate was successful in picking cues from the patient and also making sure that the patient has understood and also checking how much the patient is already aware. The candidate is good in explaining. As you can see, we're giving painkillers. He also does acknowledge the patient's response regarding pain, where he said, "I'm so sorry to hear that you're in such a pain. Yeah, sure, we're giving hot compress," and so on. Giving clear responses to queries asked by the patient is a highlight. Very less hesitation can be seen in this context, and the candidate is also able to take cues from the patient. When the patient talks about the thing that is fitted on his hand, he clearly says, "I can understand that you feel really uncomfortable." So the patient just mentioned that something is on his hand, and immediately the nurse responds saying, "Yeah, I can understand that well, that you're feeling really uncomfortable." So under understanding and incorporating patient's perspective, I would give him a score of 2 out of 3. The next factor is providing structure. That simply means how well organized the entire conversation is. Is there a logical flow of ideas? The candidate in this sample easily follows the list of tasks given, which makes the entire conversation very logical and smooth. He's able to chunk information well, especially when explaining the different techniques that are used. He could have added checking the understanding of the patient, but the pace maintained overall is quite good. One area I definitely feel the candidate can work on is in the usage of signposting language. And signposting simply means giving the idea to the patient that you're moving from one topic to the other. And so, in providing structure, I would give this candidate a 2 out of 3. The fifth factor in clinical communication criteria is information gathering. There was very little, I would say, context where this candidate had to gather information. The conversation opens with checking the well-being of the patient, and when the patient adds that he's feeling sore, carefully checks the pain score. The explanation is well done, which makes it easy to get the right information. So, I still feel this is one area where the candidate could have worked a little more, and I would just give a 1 out of 3 here. The last assessment factor is information giving, and this is indeed a highlight of the candidate. There is very clear explanation of information given to the patient throughout. If you've noticed, the candidate is very calm throughout the conversation, and this is not very often seen in candidates. He maintains a respectful tone throughout, and that really helps. The candidate does not rush in to give a lot of information. The candidate also ensures that he gives ample space and time for the patient to respond, to expand on his ideas, and to open up if he has anything to share. He responds well to all such queries that the patient had. Majority of the conversation is about giving information, and the candidate has done that thoroughly well. And I would definitely give him a 3 out of 3 here. Now, calculating all the scores that I've just put in, he has managed to get a 29 out of 39, which means he has a grade B in his speaking. Well, that is the end of this video. You'll have more such videos where you see a sample speaking first with a detailed analysis on the performance. And for such videos, all you need to do is watch out our Facebook pages and also subscribe to us on YouTube. And every time we share a new sample speaking video with feedback, you'll get all the notifications. Thank you for watching the video.
Medcity International Academy. Trusted hands forever.